moving from sick care to health care, breaking the healthcare cost curve with HP Innovative Software and Solutions. My name is Jason Kennedy. I'm a longtime Vivint member and volunteer, and I'm the president of Vivint. Professionally, I'm in the healthcare industry, and I am excited to have an opportunity to converse with our esteemed panel today. Before we get started into the event itself, I'd just like to quickly remind the listeners to join us at HP Discover EMEA 2012 in Frankfurt, Germany. It'll be running from December 4th through 6th. If you are a Vivint member, there is a €950 cost. There's a almost 30% savings off of the on-site registration for Vivint members. You just need to enter your Vivint number during the registration process. If you do need that Vivint member number, you can send an email to information@vivint-worldwide.org or contact us through the website for help. Vivint will be at the conference, and the three pillars of the Vivint organization will be represented: education, advocacy, and community. Education is going to be available through our complimentary Vivint Advanced training that'll take place on December 3rd in the afternoon, the day before the conference fully begins. We'll have two courses available, one on Make Your Test Automation Project a Success Story, the other ITIL and Beyond, the Success for Reliable Service Delivery. More information on this is available at the vivint-worldwide.org website. Where education meets advocacy will be at our roundtables. We'll have a number of special interest roundtables in the HP Expert One Lounge. The schedule of these events will be released soon. And the third pillar is community, which will take place throughout the conference in the User Communities Lounge, where you'll have the opportunity to network and meet with Vivint board members, Vivint chapter leaders, and special interest group leaders, and other Vivint members in the User Communities Lounge located on the show floor. So today's event is brought to you by the Vivint Business Intelligence, Cloud Builder, and TRIM Special Interest Groups. They're led by David White, Jim Murphy, and David Jenkins, respectively. We'd encourage you to continue the dialogue from today by joining those special interest groups on the Vivint website. And as the PowerPoint tells us, your input is welcomed on new topics. So with that, I would like to introduce our panel. For today's discussion, our panel members are Dan Gonos, an HP Fellow and Chief Technologist for Global Healthcare; Harry Kim, HP Global Health and Digital Hospital Guru; Brian McGlynn is also joining us. He's a VP of Global Accounts for Autonomy. And we're also very pleased to have joining our panel Miro Cernitate from, I believe, from the British Columbia area, like myself. And Miro is an award-winning journalist and filmmaker who does have a lot of thoughts and input on the whole topic of healthcare and the related technologies. So, gentlemen, thank you very much for joining us today, and welcome. And what I'll do is get right into our questions. And Dan, I believe the first question is being addressed to you. Oh, sorry, I just realized that I jumped ahead of myself a little bit, and I apologize for that. I'm being reminded that I do need to touch off on a couple of our housekeeping rules. Apologies, Dan and panel. This is a live session. It's being recorded, so my mistake there is for all posterity. The recording will be available to all Vivint members after this session is concluded, and we will be having a Q&A. So what we'd like to do is, if you have questions as we go along, is we'll ask you to please type them and send them in using the questions pane in the webinar control panel. So as you can see on your screen, if you click on the correct buttons and you have your webinar control panel up, you will be able to type in your questions, send them. We will get your questions, and if we have time today, we'll make sure we ask them to the panel. And if we run out of time, we'll collect your questions and send them to the panel to provide some answers offline. That'll be posted on the Vivit website. So, apologies, and I'll step back into kicking off our conversation here. So, the first question for the panel is, I'll start with a little bit of a presumption, and I'll say that a standard perception of the healthcare industry is that chronically ill or injured people will go into the healthcare system to get better. I believe what we're calling this is sick care. So I'd ask the panel, what are the trends that you see coming into healthcare technology that may have the largest impact on that specific paradigm?
Hey, Jason, this is Harry. I hope everyone can hear me okay. Maybe I'll take a first shot at that question, and then we'll, obviously open it up for the rest of the panel. But this is a really interesting area. I think it's a bit provocative to call, our healthcare system today a sick care model. But in reality, when you look at the metrics, that's exactly what it is. Roughly 75–80% of all of the healthcare spend today is around, chronic disease management. And all of the transactions, if you will, around chronic disease management. So we truly are supporting, the chronically ill. And so this notion of sort of wellness and sort of empowerment to the consumers fall into the, at least from a rearview mirror perspective. Lots of views around trends, but if I had to, sort of put what I would consider 6 major trends that we see in the industry, I'd articulate it in the following. Number one, shifting demographics. I mean, clearly, we're the baby boomer population is moving into retirement. We know that age demographics will consume about 5x more healthcare resources than any other age demographics, obviously with the exception of being born. So obviously it's, this bubble is coming and it's going to tax an already overburdened healthcare system. So I think that's number one. Number two is around cost. Clearly we're dealing in a, in a $5 trillion healthcare industry. We're spending a fairly high percentage of GDP around the world around healthcare. In the U.S. that represents 18%. In the developed economies in the 10 to 12% range. In the emerging economies, sort of 4 to 8% of GDP is spent on healthcare. Now, if you think about it in terms of per capita spending, Canada is actually number 2 in the world, right? We roughly spend in Canada, over $4,000 U.S. dollars is the translation, but $4,000 per citizen, if you will, around their healthcare. Now, you obviously look around and say, look, some of us consume no or very little or minimal healthcare, and so, the rest of that spend, and again, the majority of that spend is being is focused around those with chronic disease management. I think the other trend that we're seeing around the world is healthcare reform. Healthcare reform is happening in every single major economy. It's slightly different, but the intent is the same, right? And it's to drive, and better utilization. It's to drive better costs. It's to drive better outcomes. It's to ensure we have basic access to their citizens. But healthcare reform is applying a fairly heavy-handed agenda, to the ecosystem, and they're trying to adjust and manage to those new standards and policies. So in the fourth area, from my perspective, is around this consumer empowerment trend. Consumers, in the old day of care, I think a patient was sort of told what to do, told what's wrong with them, told, how to manage their conditions. In the world we live in today, we demand empowerment as consumers, as individuals. We expect it. We engage, whether it's with, travel industry or financial services industry or retail. We have a certain expectation as consumers of what's the experience for us. That expectation is carrying over into the healthcare environment, and it's really, really challenging sort of the traditional healthcare model of sort of a physician-centric model, a model where, the physician knows and has all of the information, and we are sort of just participants in their process, if you will. So that model is absolutely being sort of switched on its head. Fifth trend that I would sort of lay out there is really around, and it's sort of an expansion of this consumer empowerment, it's really around these consumers, looking at sort of expanded communities of care. As an example, you think about this, social media, whether it's Twitter or Facebook, you think about how families engage with each other. Ultimately, we need to be able to, support and leverage these communities to help drive better behaviors and help drive better decision makings, if you will, for individuals that have a better outcome. It's interesting to note that 25% already in the developed world, 25% of adults already act as primary care providers for someone in their family, whether it's for your children, whether it's for your parents or grandparents, and we demand empowerment for that. And so that combined with the fact that this notion of this expert patient, 70% of people look online and do research around their health conditions, and they're showing up to their doctor's office with binders full of information that is really challenging their care providers. So obviously that's a major trend that's happening. I think the last one is really around this notion of the genomics era. We have now entered the genomics era. We're at a stage now where the first human genome, the decoding of that costs $2 billion. We're at a place today where that's less than $5,000, and we're in spitting distance from a $1,000 genome. The moment this becomes a $1,000 genome is the moment that I think a recognition that genetics and genomics probably have a role in the standard care of practice. But are organizations prepared and understand what to do with genetic information, genetic profiling? When the average physician has as much genetics background as the average high school student, we are woefully unprepared for the genetics revolution and what that means in terms of driving better analytics and driving better insights and in driving better diagnostics and treatment protocols. So in my mind, I think these are sort of the large trends that we're seeing. It really, really challenges the healthcare as we see it today. It's important not to take a rear view mirror to this industry. This is an industry that can certainly learn a lot from other industries that have gone through, I think, the revolution that healthcare is beginning to go through today. I apologize for the long overview, but I wanted to make sure I hit on some of those points.
That's fantastic, Harry. Thank you very much. And definitely my experience working in technology in the medical field is definitely reflective of what you're saying, particularly my experience in the areas of medical research and seeing what may be coming into healthcare in the future.
Jason, one other, a couple of the points to build upon what Harry said was, if you think about where we are in technology, over the last 50 or so years, there have been, 4 waves of technology, and I think right now we're in the 4th wave where IT is everywhere, whether it be, in the hospital, in the doctor's office, in your home. There's several characteristics about that wave. It's around the flattening world, an explosion of information at the edge, and moving to cause and effect and delivering personalization. And some of those applications of those trends from business over into healthcare drive delivering care from anywhere in the world. So imagine a world where radiology costs are driven down by having radiologists follow the sun and read images during the day and drink great wine at night in Spain. Or if you think about the airline industry, airlines are really driving towards personalization around that experience that you have with the airlines. You fly with them, they give you frequent flyer miles, you use those in a way that best suits you. But what if you took that same business model and applied it to healthcare in creating architectures of choice? So think about considering a smoking cessation program that you modeled after an airline loyalty program. As you complete steps in the care plan, you then use the points that you gain in those steps to make personal decisions around whether you want to use it for getting your gym membership paid or co-pay at the doctor's office. So we see kinds of the blending of trends in other industries bleed over into healthcare. I think the other more important area is around leveraging automation and simulation. If you think about the body of knowledge that was available, doctors in the 1900s, the amount of information today, is exponentially grown to a point where care providers, can't possibly, understand every piece of knowledge that's known about conditions. So being able to use technology to drive assisting the right course of treatment for a patient based on the entire body of knowledge, not just what you know in your practice.
Thanks very much, Ben. Brian or Miro, did you want to weigh in on that first question about trends coming into healthcare technology impacting the sick care paradigm?
Yeah, sure. This Brian here. Let's definitely look at overall quite a bit of trends from healthcare versus sick care. I mean, certainly from our perspective, I focus a lot of time around information and analytics. And it's been a major shift in the type of information, the volumes of information, and the types of information that have come out. And we go back many years ago, and a lot of the healthcare in any particular area was really just getting access and finding the information. Now we're seeing quite a bit more from mapping of genomes, and what's even more interesting, we're seeing in a lot of, I say more interesting, but different in a lot of cases, is what we can do with it, really understanding it, and this huge pile of human-created information. What if we're able to go in and look at a person's behavior, even in the wild at this point, and see that there may be a trend or some kind of a propensity based on their behavior that could lead to health problems? Or what if we're able to go through and look at infectious diseases and predict where they're going to outbreak ahead of time and be proactive? It really goes into to look at that. And the biggest issue, Harry hit it right on, certainly through our conversations with many of the health ministers and others across Canada, has been a growing concern that costs are rising right now 7% per year. And certainly as the baby boomer bubble starts pushing out further, we're going to see that skyrocket. Revenues only go up at 2%. So it shows as an issue that we need a fundamentally different approach to how we look at healthcare. And that's where we go into for prescriptive, proactive versus really the sick care or the reactive approach. And a lot of technologies are going into it and really understanding that. So things that we've been doing in our research and the autonomy division of HP Information Management, been looking at human data, looking at the shadow of what people have created. Google made a major shift in people going in and being able to access and locate it. But what about the unspoken data, where people aren't going through and volunteering what their problems or conditions may be, but instead certain behaviors and trends and certain patterns that would indicate that there could be a problem, or there could be an issue, there could be a risk. It brings to mind a whole other set of questions, a whole other set of areas what you do with that data, but that brings in a whole other paradigm, really that paradigm of big data and that ability to understand it and digest it. And that's certainly a big trend. We're seeing a lot more focus on it, a lot more interest on it, people scratching their heads in some cases as well, saying how do we deal with that? But that's certainly what I see as probably one of the largest driving trends that's going to shape things over the next decades to come.
Yeah, and it's Miro here. One of the things I would add to that is that we're going to get a lot into, I think, the democratization of the technology and the platforms for access to health data is really going to change the way people access the system, hospitals and their doctors. For example, a smartphone that can connect into your glucose readings from a diabetes test and get into your diet and get you into all sorts of better health regimes, which will meet the paramount goal, which is keeping people out of the system as much as possible, out of hospitals, which is where the cost is. And as this fiscal and demographic crunch hits us, I think we're going to be seeing more people using things like smartphones and iPads and new software systems to do precisely that.
Yeah, this is Harry. Just to add a couple of sort of comments as well. At the end of the day, we got to keep our eye on what's the big picture here, right? And the big picture is we got to impact and affect the outcomes, the health outcomes for individuals. And so if you just sort of zoom back even and open the lens even wider, what is it that actually drives outcomes for your health, right, and for your wellness? There's actually roughly weighted equally, there's actually 4 factors that do that, right? And healthcare is just one of those 4 factors. The other 3 are, the genes that you're born with, the environment in which you live, and the lifestyle that you lead. So if you think about those four factors, healthcare, lifestyle, environment, and genomics or genetics, and then you sort of apply an information view to that, right? This is where it'll warp your mind a little bit to think about, oh, geez, we're not just talking about electronic medical records. We're not just talking about, digital pathology and PACS and some of the basic data. If you really want to make a difference, you got to think about how do you bring information from lifestyle, genetics, environment, and your healthcare, personalize that to individuals so that ultimately they can make better decisions and drive better behaviors to get to better outcomes. And that's where you, I think, have a better shot at getting after the proactive health, getting after people before they're ill and before they hit, and get into the chronic disease where, they're in a life, then they're managing for their lifespan. So, that's the sort of thinking from an HP perspective around, 5-10 years out, what does the information architecture look like? How do you do this, and how do you connect, this old school stodgy provider environment with the very fast-moving mobile, app-driven, smartphone consumers who are looking for information? The magic is how do you mesh those gears together, right? And I think technology, to Myra's point, has been democratized. We know we have the endpoints. We know we have the content sources. We need a way to orchestrate this together, and we need to bring analytics to help create meaning out of it.
Yeah, maybe I'll throw a little piece on that. It's interesting. It's Brian McGlynn here. One of the things I've been working with, and kind of your point that with healthcare providers, it is a challenge, and it's a challenge that a lot would face, and is embracing technology as a whole change management part. We're really seeing that big divide where there's a traditional approach where even traditional tools have been difficult to go in. So let's take, for example, electronic medical health records. It's an area where, there's certainly a great discussion on privacy and items like that, the fallacies of some of the de-identification efforts and others we can certainly address. Putting that aside, there is certainly a lot of value as well in being able to say that you own your medical data, you own your information, and you should be able to move it from place to place. And we've been working with some of the health authorities and the e-health groups to try to understand that. It does present a lot of challenges where getting organizations to either admit to sharing data, even normalizing data, and then getting it to where it is sort of a mobile pass card. You can go around and say, here's my health record. I own it. It's in this particular cloud. It's in this particular access. And that way you can look at it. And then how do you do the analytics on top to where you can start, are you allowed to, are you going to offer your data to where it can be monitored and looked for anonymous statistics and other sorts of things. But it's something that's very much alive, and it is a problem as organizations are going in where maybe you have in healthcare providers some of the very centralized hospitals, some of the larger medical groups, but you'll have the independent providers, which may account for hundreds in the case of where we'll be in Ontario, that either need to get on new technology or not. And it really raises a challenge of how do you move an industry that in some cases really embraces it, in some cases not, to use these just for the betterment of public health care delivery.
That's an excellent question, Brian. And it leads into my next thought, which is also driven out of some of the points that Harry, Dan, Miro, and yourself have made in the last in your answers to the first question. And given the fact that you touched on it, that many of these jurisdictions, many healthcare jurisdictions globally, are struggling with the challenge of balancing improvements in delivering wellness. We can simplify to saying healthcare, but I do agree with the earlier point from Harry that we're talking about wellness. Delivering that and delivering better options for their constituents, but acknowledging the fact that we have a continually impacted global economic state. These technologies, they cost money. The common perception is a lot of money if we're talking about genomics equipment, if we're talking about the various types of scans, or even the consumerization to a degree where we're asking people to have medical diagnostic and monitoring equipment in their homes. How is the growth of this technology going to offset the growing costs of delivering healthcare to an aging population?
Jason, hey, I'll take that one. This is Dan. So if you really think about healthcare, and you think about electronic medical records and other types of technologies that folks are looking at these days. Electronic medical records promote efficiency, right? But we've got to, in order to bend the cost curve, we got to get healthcare effective. So what is it that, what is it about healthcare that gets us, into that paradigm of effectiveness versus efficiency? And it's about getting the right care at the right place at the right time at the right cost. It's about situational awareness. So a few months ago, I was in an automobile accident, and in the period of 2 hours out of the car into the ambulance, into the ER, and out, about 20 people touched me. And each of those 20 people needed to have some sort of situational awareness about my condition, and they needed to coordinate their activities to get me, to the hospital and treated and discharged. If you look at the examples in the U.S. around the coordination of care and delivering health care at the right place at the right time, you look at a study that was done that basically demonstrated without coordinated care across that entire healthcare continuum, we were spending about $13,000 per patient per year. And after coordinating care and delivering it at the right time, we were delivering that more effective care at about $3,500. So think about that drastic impact in that savings, through the use of technology. And when I say through the use of technology, I'm not talking about spending millions and millions of dollars of putting technology in to solve specific circumstances. But what if you put technology in to monitor known guidelines? Think of an ICU where in a mode of operation in the U.S., 98,000 patients, or I'm sorry, about 180,000 patients are killed each year through medical errors. So, where those medical errors come from is, around addressing known guidelines. 41,000 central line infections, 250,000 cases of ventilator-associated pneumonia. And as you think about it, how do we then put technologies in place to best, address those known guidelines? So think of a nurse. A nurse walks about 8 kilometers per day and has about 250 different interruptions in their 8-hour shift. So how can you deploy a technology that increases the effectiveness of healthcare while at the same time improving the life of the nurse? So, for example, we have a solution at Lucile Packard's Children's Hospital where we've deployed a patient safety dashboard in the pediatric ICU. And basically, it's kind of like, the airline industry. While you're waiting for a flight, you see that you're on the upgrade list, and then ultimately the upgrade, clears, and you walk up to the ticket counter and you get your new boarding pass. But what if a nurse could walk anywhere in the ward, look up at the patients that are in her care, and identify whether the patient is at risk for known adverse events, such as a ventilator-associated pneumonia. And she could look at a stoplight that basically says green, the patient is, has no risk, or yellow, the patient's at risk, or red, the patient is in imminent danger. She could then, without having to go back to the nurse's station, doing a query onto electronic medical records, she can, pretty much, look at a glance and know where she needs to go next to help that patient. So if you really think about it, the impact of that basically, improves the care for patients. Other examples, around the world, a 50% reduction in adverse events and 20% shorter length of stays. Those are real dollars with the application of technology, and technology to solve simple business problems as opposed to spending multiple millions of dollars of deploying technology that you can pretty easily stand up for a small amount of money.
Hey Dan, this is Harry. Let me add on to this thought here. Fundamentally, the framing of the question, technology and cost, that's part of the issue. Is we think of technology as a cost. We don't think of it as necessarily an enabler. We don't think of it as necessarily how does it drive the value of the business, right? I mean, that connection is a translation that many executives have to go through, but it's not necessarily apparently clear up front. So when we think about it, and let's use the nurses as an example, right? So he or she, from a nurse perspective, maybe, and the research shows, is spending less than 20% of their time on what we call warm hands, right? So direct patient care. So where's 80% of their time being spent, right? And sort of Dan alluded to that, but fundamentally it comes down to they're chasing information, they're chasing assets like the gurney or an infusion pump, or they're orchestrating workflow, right? So 80% of one of the most scarce resources we have in our healthcare system, 80% of their time is, I wouldn't call it non-value add, but it's missed the opportunity to be technology enabled. This was, one of the predominant value propositions when, HP started thinking about our digital hospital program. And really, it's really about how do we create a better experience, how do we create better efficiencies, and how does that lead to better information, therefore better decisions. And, the results have been quite remarkable in many respects. And, I'll just give you the one guiding principle that I think broke the rules, if you will, that made all the difference. When we went into some of these hospitals, the fundamental guiding principle in terms of your IT requirements, in terms of your IT infrastructure, was not about, hey, what does this department need? Hey, what does that lab need? Hey, what does this, this group needs? It was all driven by the patient's experience and workflow. That drove and drives the information requirements. What do you need when? How do you express it? How do you capture it? Is there an opportunity to bring insights in that interaction right through that care process? And by doing that, it fundamentally broke down the walls and the silos that we see inside the hospitals. It forced the integration between the nurse call system, the facility controls, your EMR and ICT environment, even your patient terminals and entertainment systems, right? It forced the integration to happen across the board, because by doing that, you can fundamentally transform the workflow. Some of the results that come out of this have been quite strong, right? And Dan mentioned, a 20% reduction in length of stay. Some of the other results, because of this approach, has actually driven a 30% increase in outpatient capacity, and overall, end-to-end, it's actually reduced the operating expense. So this is not about bending the cost curve. There are examples where they broke the cost curve, where they actually figure out how to move it the other direction and not change the trajectory, but fundamentally have a downward trajectory around it. So, there are examples of how technology can drive a hell of a lot more value, not only from a workflow and get the right information at the right time, but from an analytics perspective to be able to drive the decision making. That's the opportunity, but I will say it takes guts and it takes leadership, and many of the technology leaders in healthcare don't have the right seat at the table to drive that agenda. So there's a change management issue that we're dealing with across the board to really get technology to the right level. And let's disaggregate technologies here for a second. We're not talking about having the best medical technology in the world. We're talking about driving the best information technology in the world. Because ultimately, hospital executives are happy to spend $1 million on the latest MRI machine, but they are often, worried about spending $1 million or X millions or whatever it happens to be around a disaster recovery or an integration of, this system or that system. So, and what happens is we end up having very expensive islands of information that are not integrated together. That's the opportunity for this industry, is to catch up to where most of the other industries have gone through, drive this integration, transform the workflow, empower your consumers, and bring analytics through that process.
Brian or Amiro, do you want to weigh in on that question?
Yes, Brian here. So technology is definitely, it's a case where you look at the investments, and I think Harry got a pretty good point. We look at technology looking at as opposed to an approach of, are we going to tie our systems together? How are we going to reduce our costs? Costs are important. I think altogether we've gotten a very good sense in the last 10, 20 years around information technology management that cost takeout's a piece. But what about managing to results, managing to that inevitable top line performance? So a lot of it is how do you apply it? How do you measure it? How do you approach it as really a key performance indicator around that? I mean, ultimately, and by centering it around the patient and centering it around the overall care that's provided, that's really a powerful offering and a powerful approach to dealing with technology in that case. A lot of things that we look at and certainly going in and help justify it is exactly that. It's an information overload. One of the parts we run into, you can go across any industries and they're very specific, absolutely in healthcare. Let's take diagnosis, for example. We look at the cost of either misdiagnosis and even from a perspective, do professionals have that information at their fingertips at that time? You kind of fast forward to what if a healthcare provider at the front line, at home, bedside, we're able to, from a single tablet device, look at information regarding a patient through their medical record, pull in all their data, but also be able to tie that into trends that are happening across the world in real time. Understand, are there particular issues around maybe infectious disease? Are we seeing a spike? You look at meningitis is going across the states. Are there particular parts around that? Or we look at Legionnaires. There's recently been some outbreaks around the states and even Quebec City around air conditioning and other items. It takes weeks sometimes to come up with that, correlating that information down. What if information like that were able to be brought in very quickly, being able to brought in along those lines and detecting those all from the bedside and really reducing that information overload that is on professionals. So rather than spending 80% of their time hunting for information and pulling information together, putting it into where all that is put together at someone's fingertips, correlated, and provided in really I want to say a conversational or a consultative matter to where someone could diagnose looking at exact findings that come through from the British Medical Journal or other American Medical Association journals at this point, being able to do that and help from a computer perspective to help diagnose in other parts. There's a lot of opportunity. There's the technology, certainly as Harry puts it coming on, these are technologies that have been really classified as IT technologies. They're not. They're really business type technologies. How do we get them over there? How do we educate folks in hospitals and primary care physicians and others around the capabilities that these tools will offer and look at them as an investment in the actual outcome versus really an investment to change a process? And that's really a big shift that we need to see. And we are seeing it in some cases, but ultimately that is kind of a hurdle mentally to come over, to start embracing these technologies that ultimately contribute to better patient care, reduction in diseases, reduction in infectious diseases, and just generally overall better outcome.
It's Miro here, and one thing that I've done in my career is covered a lot of provincial and federal budgets in a lot of different countries and provinces. And a trend that I've seen happen at the kind of the deputy minister sort of administrative level that I think informs a lot of this debate is the paramountcy of savings and cost efficiencies in the healthcare system while providing the level of healthcare that's expected. And I think what we're beginning to see is the embrace of a kind of a disruptive view of technology within what is often the sclerotic system, which is healthcare as it's traditionally set up. Because of the cost pressures, a lot of these administrators and practitioners really are looking for what Harry described, or things that break the cost curve and also establish possible new systems that take out layers of costs that are in it that have been traditional. So that's something I think we have to look at in terms of technology, and it's almost, I think, some of the onus now will also be on the providers of that technology to start to present more of that sort of story to the people who are buying that technology, whether it's a private healthcare system or whether it's a public one. That's what they're looking for. So there's really a lot of big opportunity there, I think, if the case can be made.
Excellent. Thank you, gentlemen. Taking a lot of that discussion that we've had over the last two questions that I've posed to the panel, we're obviously talking very specifically about the healthcare industry, and in the common perception, the healthcare industry, it's largely considered to be a very specific industry with some somewhat unique requirements around privacy, urgency in the delivery, and as we've discussed, some weighty financial implications. But given the technologies and the advances in technologies that we've been discussing, how can any of the developments that we're talking about that are being driven by healthcare, how can those see application in other industries? Or perhaps, to wrap the question the other way, are these technologies that are seeing advances in other industries that need to move into the healthcare arena?
Maybe I can take that one at Miro here. I think this is that's a really exciting question, and I like to think of this as a little bit like Tang. You know, remember the orange juice that was powdered orange juice that was invented during the Apollo missions, from the moon missions, and same with Velcro. And what I'm getting at there is that the healthcare system is often viewed by people as almost a utility that's there to be for them when they want it, you know, at some stage of their life. But really, what's also happening, both in the private sector, but also I think within the system, healthcare system itself, is that you really are looking at what can be a massive incubator for technological change. You know, as Harry said, I think it's $5 trillion in global healthcare spending, and it's growing at really a phenomenal rate. And within that system, they really need new technologies to make it sustainable. So that presents, I think, an interesting platform and petri dish for all sorts of new technologies. And I mean, I'll open it up to the experts there on the technological front. But one thing that I think is very interesting is on privacy. When you look at data and informatics, and you know what's happening in healthcare, and the amount of information we're gathering on people, and everything from their their diets to their longitudinal histories to their genomics, this is like really valuable stuff. And the question is, how do you get at it? And one of the big hurdles that I found in this debate it's always the first thing you deal with, and it's the suspicion that you can't protect people's privacy, or that the data will be used improperly, or it'll be twisted, or whatever, or lost. And so so the healthcare system obviously is doing a lot to deal with privacy issues, and in fact, I would say it's probably at the forefront of that important debate, and the new technologies and systems to do that. So you know, I think that the healthcare system, as it gets through that and solves these issues, it has a lot to offer just in that particular part of the private sector. So, you know, if the healthcare industry can deal with personal information, some of the most intimate you can ever think of, that says a lot about what you do, how you handle other kinds of data when you get into something like with what Google is doing with AdSense and picking up people's habits on the internet. So I think there's the systems and technologies and ideas that are being developed in the healthcare system there can definitely, just like Tang or Velcro, be used on the outside, and probably even leveraged to a greater degree. That's just one. I think there are many more.
Yeah, and this is Harry. I agree, Myra, with the characterization of that. Maybe to give a little color commentary, if you think about the financial services world, it's interesting that I can go to virtually any country around the world, countries maybe that I've never been to, get out my ATM card, find a local machine, stick it in, and it authenticates me, it entitles me, it gives me great local currency translation, a secure transaction, and I get my money, right? And I've never even been in that country before. Yet in the healthcare world, I can't go to the same hospital the next day and they typically know what I did, let alone go to the sister organization and hospital or clinic, if you will, right across the street, and they have any idea, what's going on with me. So there's huge chasm, if you will, to what's happened in other industries. Dan mentioned reservation systems and airlines, and obviously financial services. But fundamentally, if we can, if we can secure financial data, we can secure and have some level of security around health information. Now, I think the reality is the privacy issue in healthcare is largely smoke and mirrors. It is a concern. It's a very real concern. But but when you actually think about the amount of privacy concerns that people as individuals really have, imagine how much data and information they're putting out there on Twitter, Facebook, and social media sites. That is I wouldn't say a special interest concern. It's a policy, it's a public issue that needs to get addressed. But it is not necessarily a, individual consumer-driven concern, that hasn't been overcome in other industries. Maybe the last point that I'd sort of mention around this, and it's interesting in healthcare, we see healthcare technology, healthcare IT, M-health, e-health, I-health, everything in between. At the end of the day, the best technology in the world disappears. This doesn't need to be iHealth, eHealth, mHealth, vHealth, whatever you wanted to call it. This just needs to be health. This just needs to be how we get things done. We are living in an environment where, it takes 15 years, roughly 15 to 17 years, to go from, insight in terms of either a clinical protocol or a best practice or a piece of innovation to put that into standard practice. Almost 1.5 decades it takes healthcare to do that. By not only does technology has an opportunity to drive better, efficiencies and costs, but also it has the opportunity to drive better quality of care as well as speed innovation into practice. So we got to think about, and this is one of those industries where technology doesn't fight at odds with those agendas, meaning the same technology investment will actually drive efficiency, quality of care, and speeding innovation into practice, all with the same investment. And in many other industries, it's like you have to make trade-offs between, efficiency and quality, or quality and innovation, or, but this is one of those special industries and special times where IT can make a difference that has multiple faces and multiple value propositions.
Any of the other panelists like to weigh in on that?
I agree with what my distinguished colleagues have just covered, but I just want to make one point. Healthcare is largely behind the curve. The technologies and business models and ubiquitous nature of processes, advances in other industries, much faster than healthcare. So I see that healthcare can benefit from using best practices and benchmark processes from other industries to drive and improve the delivery of care.
Thanks very much, Dan. Moving to the next question that I have for the panel. As we're speaking to technology leaders who are listening to this panel right now, how can we as directors, managers, planners, VPs in various organizations, CXOs, let's say, how can we start planning today to leverage these game-changing technological innovations? Where do we need to be investing our energy, our resources at our disposal today so that we can maximize these kinds of technological benefits?
So Brian here, I'll jump in on that. So it's definitely, it is absolutely the place to look at, start planning. So I had a meeting with some of the health authorities in Manitoba around e-health records last week, just kind of give a story, or about a month ago, excuse me, give a story about it. And a lot of it really came down to, we had representation of their chief information officer, chief medical information officer, and we had information regarding some of the other folks that were in there around doctors. We had representing, we had folks that were IT workers, we had information workers, we had a whole cross-section. And we brought to the table some new technologies, some demonstrations, some parts and processes. And it really brought into a lot of, wow, this is exciting. The problem it really came back to was, well, we don't know how much data we have. We don't even know if we have data that we can take advantage of that. So there's a lot of thinking that has to go in. And we look at exactly the parallels of other industries. It's happened along there. I work with financial services. I work with media and entertainment. I work with consumer manufacturing and packaged goods, and they're all evolving in different parts, and a lot of it is that outlook, that first shift of how do we look at technology differently to where it's an enabler towards our outcomes, start focusing it on an outcome as part of technology. And it's a shift that some organizations have made extremely well. In the case of mobile banking, I think with healthcare, how can we take that and translate it, but also kind of openly look at how we can embrace that towards the technology. So that there's a lot of, I mean, at a very high level, kind of committing to change, committing to looking at net new ways to approach problems and following through, investing a little. We're working with a proof of concept with another health authority right now. Those are the sorts of things that let's try it out, put a sandbox around something and see, can we get some different results that ultimately would go through. And partly, too, there's organizations that need to look at it, government organizations and senior management to get aligned to look at really an R&D and an investment agenda. If you look at private sector companies around the world, those that have gone in and committed through labs and committed through other parts and have an institutionalized R&D towards enabling technologies towards better outcomes that have profit from it immensely, but there needs to be that kind of a commitment, really from the top down, a commitment to change and a commitment to innovation to embrace these technologies and the cross-section of new technologies and to continuously evaluate new technologies to embetterment at all levels. And once that culture's been instilled and that approach, then these technologies can be thought of as enablers, thought of as outcome driving, and really be embraced at a lot more at that level. That's really my high-level thought around that. I mean, my colleagues want to jump in and add some color on that as well.
Sure. Jason, you know, if you think about healthcare organizations, there is no healthcare organization that's, you know, the same. So each organization is going to have their own challenges and their own issues and their own outcomes. And there's not a prescriptive model on how to go do this. What the model is you know, start out small. Start out with the biggest bang for your buck with the, you know, lowest investment. So, for example, you know, we talked earlier about Lucille Packard's hospital. It was a simple, you know, simple solution for a pediatric ICU, one department in the hospital, that wasn't developed by technicians. It was developed by the docs, the nurses, with, you know, some smart technology guys. But it was ultimately at the folks that would actually use the technology or interact with it were part of the development. And as a result, the solution was created to solve that specific problem. And then other areas of the hospital want their own versions of that, and then it just goes viral from there in impacting outcomes. So it's about finding the right outcomes, finding the right use cases, starting out small, and building, you know, from that base outward.
Yeah, this is Harry. I totally and absolutely agree with Brian and Dan. I think my color commentary here is, at the end of the day, as technology leaders, if you are not facilitating the discussion and the linkage between technology and business and health outcomes, I'm not sure you earn a seat at the table, if you will, to go drive an agenda. So that's number one. Is I think I see the technology leaders as facilitators and bridging, if you will, again, the business side, the clinical side, as well as the technology side. I think the other thing that we need to think of as a core competency is, you know, us as change agents, and us driving, not only in driving that linkage and facilitating it, but we have got to drive a sort of and have a view that we ultimately have a change management problem here. We don't necessarily have as much of a technology problem here. But obviously, change management is hugely, hugely important when you think about the adoption side. If you're not driving this linkage, if you're not facilitating these discussions, and if you're not viewed as a change agent, then what are we, right? From a technology perspective, we get stuck managing SLAs. We get stuck, you know, operating and maintaining, you know, the operations, and we get calls when someone brings their new iPad, you know, into the office, and they're looking for help to, you know, get it connected to the rest of the system, right? So we're dealing with operational, you know, issues, and we're not actually, and we're viewed as a cost, and we're not actually driving value. So again, you know, linkage to outcomes, be the facilitator to link this together, and ultimately we got to be change agents at heart.
Miro, did you want to weigh in on that?
sorry, I was just a little disconnected there. Yeah, I mean, I just basically, get back to what I said earlier. I think that the healthcare system is a massive incubator for a lot of new technologies, and there's nothing like necessity to be the mother of invention on these things, and that, I think, is what's happening. And I think the challenge is going to be to find the parts of the system that are really open to the kind of innovation that's going to happen, because it's going to be driven by cost and it's going to be driven by the consumer. So I think that's the path that we're on, and it obviously has to be linked to preserving and enhancing the quality of healthcare.
Excellent. Thank you very much, gentlemen. We're nearly at the end of our time, so what I'd like to do is allow you each about a minute to present, we'll call it a closing statement, but also if you could, in that, indicate where you feel that the Vivit members who are listening to this podcast would have the opportunity to learn more about these kinds of innovations, trends, and engage in further discussions. I would seed that by indicating once again that the Vivit Business Intelligence, Cloud Builder, and TRIM Special Interest Groups online at the Vivit Worldwide website is a great place to start. But I'd just like to hand it over to each of you for a closing opportunity.
I'll start, Jason. So, moving from sick care to health care is really about situational awareness at the patient. Whether it's situational awareness in the hospital or it's situational awareness at home, it's about delivering the right care at the right place at the right time. And so whether you're in the hospital or whether you're in the home, we need to be able to understand your circumstances and address the right changes in behavior or change the environmental conditions of your environment, whether you're in your home or whether you're in the hospital, and be able to improve quality of life. If you think about our digital hospital program, which I'm sure Harry will talk about in a minute here, I think it's engaging in that conversation. We would be more than happy to come talk to you on a one-on-one basis on our experiences and where we're going in the future.
Yeah, this is Harry. I'll go next. So as I said before, fundamentally the best technology in the world disappears. It just becomes embedded in how we do things. I think the market today in healthcare has been flooded with thousands of point solution providers driving a specific functionality, a specific use case, a specific outcome. I think the HP sort of point of view here is, these are needed innovations, these are needed solutions, but our goal is to simplify the experience for care providers and for patients by driving an integration and sort of information liquidity, if you will, across all of these different areas. At the end of the day, I think organizations come to HP because, we not only have a point of view in other industries. I mean, heck, we do 80% of 911 calls are on HP systems, and 80% of stock exchanges happen on HP technology. So we get it in terms of fully scaled out, fully reliable, fully resilient sort of, architectures. But they really want to talk to HP because, we have end products, end user products. We have a huge portfolio of analytic software. We have the infrastructure, the networking, and we have the services to sort of deliver and sort of bring that story together. So fundamentally, when Dan and I go around the world, it's really about the conversation of what is a market or an ecosystem or a country trying to accomplish, and how do we fit, and what's the role of technology as part of that. We are not necessarily a hammer looking for a nail in terms of we have a product to sell. Now, obviously, our digital hospital program is a great reference for us. It's a great way to engage in that dialogue. But fundamentally, we see the healthcare, not only taking place in the hospital, but fundamentally, we got to be able to orchestrate that care into the home and orchestrate that care to mobile consumers. that is our view in terms of how we, from an HP perspective, want to help drive the transformation. And we also, absolutely want to drive empowerment to the consumers as well as drive efficiencies to the, hospital and healthcare providers. So lots of interesting things out there. It is very important to open your lens up, especially in the planning process, especially in the what do we want to be when we grow up discussions. You need to open your lens up. If you don't open the lens up, you will just do things incrementally better to how you did things yesterday. And in the healthcare world, that's not enough.
Thank you, Brian.
Thanks for the opportunity to come in and chat. I mean, it's definitely very exciting times in technology. Certainly taking technology in, the conversations I've had with healthcare providers, with executives in the healthcare space, and certainly with HP in our information management group. We've acquired a company called Autonomy that does some fundamentally different ways at dealing with information, human information, things like analytics, big data, things like the Vertica database that we're integrating into a lot of electronic health medical record systems right now. A lot of things that we can do, and really through understanding data very differently, understanding human-based data very differently, and that's really the trend to keep up with. I'd certainly invite folks to read a bit more about what we do around the way we've applied mathematic algorithms to understand data better and to really do some pretty amazing things. So you can reach out to autonomy.com and actually check out our healthcare area. We've recognized this at Autonomy in the last few years, taking our intellectual property, taking what we've learned in other industries around e-discovery, around information aggregation, around security and surveillance, and applying that into healthcare needs. And we formed a special group for it internally to really focus on developing this out and growing it substantially. So I'd really recommend anyone that wants to learn a bit more about it, take a look at what we're doing. Take a look at the autonomy.com webpage, which is an HP subsidiary company. You get a lot more information on that as to where we see some trends and directions happening inside the industry. So thanks again.
Thank you, Brian. Miro, closing thoughts?
Yeah, I'll make them quick. One of the things that I'm doing and with other people is really looking at healthcare data and designing data and the platforms to use it. And I think Harry is in fact speaking at a conference tomorrow that we're holding in Toronto called the dataeffect.org. And it's really about this interface of all of these different interests in healthcare. And I think what we're really seeing happening, and it's going to happen even more so, is the accelerate. I mean, is this whole approach to healthcare as almost a design issue. A design issue, I think, in your life that will begin from birth, and technology is going to be a part of that. And I think we're seeing the beginning of that with the amount of data and the aggregation systems we're getting to find and to pull information out of it, and then this, as I called it earlier, democratization of technology, the ability to have a smartphone in your pocket. That's just all going to accelerate. But it is going to be one big design system, and that's where technology fits.
Excellent. Thank you very much, Miro. And so in closing, I would like to thank each of our esteemed panel for your time today. And I'd like to remind anyone listening that you can continue to contribute to these conversations online in the various forums that were mentioned by the presenters. And thank you very much for your time for listening to us. Have an excellent day.